Thanks, Brooke. You know, you're looking for a good way to save some money this year. How about investing your time in helping your child brush and floss their teeth properly? This really can help prevent cavities and can save hundreds, if not thousands of dollars in dental bills. Consistent flossing and brushing can make all the difference in making sure cavities don't crop up. So Dr. David Stewart is here from Little People's Dental, here to explain why we have to brush the way we do. And your kids don't think they're brushing there on their own, because really, even when they're 3 or 4 or 5 or 6 or 7, sometimes need help from mom and dad, right?
Yes, and that's the thing, is it's important to note that brushing and flossing can make a difference. And like with any task you're doing around your house, having the right tool makes a difference. Now, as we look here, there are lots of different tools. These are all the same toothbrushes from the same manufacturer, but you can see we've got different sizes, different forms, and that can be confusing as you buy toothbrushes. What do I get?
So if I'm getting a toothbrush for my kid, what is the perfect toothbrush to get?
Really, as we look, you want one that they can grab onto, that's got a handle that they can hold onto and you can hold onto when you help them. Also, small head, soft, round, tufted bristles, and well made. There are lots of toothbrushes that aren't well made, so you want to look for a quality toothbrush that will hold up. If we look at spin brushes, there are lots of different sizes, and again, same manufacturer, different heads. This head will not access where it needs to get in a child's mouth, and a lot of places an adult's mouth. So a small head, soft bristle brush is kind of the take-home message that I'd recommend as you look quality made. Also, if you're doing a rechargeable toothbrush, is what I'd recommend, and a replaceable head, because your head will wear out and need to be replaced every so many months. And so really a rechargeable, small head, replaceable head toothbrush will save you in the long run.
So really the idea of certain brands or certain gimmicks with certain things is not as important as just having the right size toothbrush for the right size mouth.
Exactly.
Okay, let me ask you about kids, because we were talking a little bit about, I have kids, I have 4 kids, I've had to go through all of them brushing their teeth. I still brush a couple of them every night. What's the proper way to do that? How do I teach my kid how to brush? How do I brush their teeth?
As soon as a child has teeth, they need to be brushed. So parents will say, when do I start? As soon as teeth are in their mouth, they're at risk for decay. And so as soon as they've got teeth, 6 months to a year, start brushing. Now those children are not cooperative. And so a way that I've found that really works is to lay them back, okay? And so as you do that, you can sit right flat on the floor, and you can see a child here laying back. If they're not cooperative, you can slip their arms right underneath your legs like that, and you can get in and brush. This is like we would do in the dental office. It allows you access. It allows the child to sit comfortably laying back in that position. And I use this even in my older children because it's more comfortable for them. We don't have to do hard way with them. Like this little girl is cooperating, so you can get in, but you can tilt their head back. They can sit in that position for several minutes.
Well, you mentioned the hard way. What if they resist? I mean, it's really important to brush their teeth, isn't it?
It is, and know that your 1, 2, 3-year-old likely will resist. Some do, some don't. And so as we look at that, parents will say, well, when do I transition that to my child? Studies show us until they're 7 or 8, they don't have good dexterity to brush on their own. 9 or 10 to be able to floss well. So really, until a child is 9 or 10, a parent should be in there daily helping them to brush and floss. So what I'll often do is they become more emphatic about doing their own teeth. I'll say, have them do the morning brush. That's what they're in charge of. The nighttime brush, when things are a little slower around the house, you can get more in the groove. That's when you have them lay back, where you as a parent floss and brush and help them to learn those skills.
But even up till a kid is like 7 or 8, you said mom or dad should be brushing the teeth at least once a day.
Yes, and studies show us where they take kids and teach them how to do it and say, this is how you do it, get in and do it. Till that age, they just don't have the dexterity to do it. Like when they tie their shoes. You wouldn't expect a 4 or 5-year-old to tie their own shoes.
Okay, you even have some floss. This is the one thing I hate and I don't do well. So give me the scoop. What do I do here?
Well, and that, you know, as we look at that, the question is, what are we doing when we're in there? And there are really 4 surfaces on a tooth that we're trying to get. The number 1 place we get decay is in pits and fissures and in between where the teeth touch. And so with the brush, we're trying to get 3 surfaces. Outside along the gum line, so we're angling and we have to change the angle. We're getting along the gum lines, then a chewing surface, and then on an inside surface along where the tongue is. Now the brush can get those surfaces, but it can't get where teeth touch. And so that's another big area that we need to get, and the only way we can get that way is with floss. And so flossing truly is as important as the brushing if we want to prevent decay in our own mouths or in our children's mouth. Now, a lot of people don't floss because it's uncomfortable, it's difficult, they just, dexterity-wise, it's hard.
Yeah.
What I have found works is if you wrap it around your lower 3 fingers and get the tension that way. Then it leaves you with dexterity with thumb and pointer finger to grab and really get in and go. So if your child's laying back, they can lay back and you can get in and do that. And your own mouth, that's very helpful also.
So lower 3 fingers, up through 2 fingers you can use to get in there. Okay. Some great idea. If you want some more information on how to prevent tooth decay, you can go to Dr. Stewart's website at littlepeoplesdental.com. He's got an office down there in South Jordan. You can also go to our website. We've got a link there to Dr. Stewart's website on our website, which is studio5.ksl.com. You can get your kids getting their teeth all in right shape for Christmas, right? Thanks, Dr. Stewart.